when it comes to getting ready for medical school interviews, there are loads of different methods to get ready, but the most important thing that you need to have is work experience. Something to draw upon during your medical school interview. Now, in this video, I hope to go through the why medicine question, but first of all, I would like to go through the framework that I would use when answering this question, and then go on to watch the Grace clip where we can watch it and try and dissect it and see if we can use this to answer the why medicine question. Now, of course, this will not replace real life work experience or volunteering, and when you do go into your interview, please do not use Grey's Anatomy or any kind of medical show to explain why you want to do medicine. But this hopefully is just a way for you to think about how you would go about answering this question. So when you do have your real life work experience, you'll be able to formulate an answer effectively and hopefully get that place to study medicine. Now, there's loads of medical shows out today that really kind of go into the different lifestyles and the different things that doctors may see. Now, of course, a lot of them are exaggerated. Grey's Anatomy, for me personally, is my favorite. Of course, is very exaggerated, but hopefully this can be a more light-hearted fun video. And if you enjoyed them, please feel free to subscribe and like for more of these videos. Okay, so first of all, we need to firstly go through the framework of answering this question. Now, over here, I just have roughly gone through this question. I've used my own experience and I will kind of expand on these bullet points that I have here. So why medicine? So for me, the first thing that I did was to just start off with a quick monologue of why I personally wanted to pursue medicine, and that was because, initially I wanted to go into basketball, but then after some research I realized that it was not for me. The main reason being the lifespan for a basketball player is quite short, whereas a doctor, the longer you work, the more valuable you are, the more useful you are, the more experience you have, just the more beneficial you are as a doctor. Most medical schools today is 5 years or so, then there's 2 years of foundation training, there's even more years to become a specialist. So by the time you're fully specialized as a doctor, you'll be quite mature, and that's when you're at your peak, that's when you're the most valuable. And for me, that's something that I really liked about medicine. Then moving on from this, I went on to explain this a bit more. I enjoyed the study of physiology and anatomy during my degree, but I did not enjoy the lack of contact with patients and people in general. Of course, doing biomedical sciences, it was very similar in terms of the core science content, but there wasn't really that much contact with patients. It's mainly lab work, it's mainly working by yourself, unless you maybe find a career where you work as a scientist with other members of a team. But me personally, I wanted to work with patients, I want to work with different people, and medicine offered that for me. Moving on, I still want to do research in some capacity in the future, but not as my sole career, because of course research is something that's very vital in medicine. It's good to mention this in some way if you can during your medical school interview, because medicine is all evidence-based and research plays a massive part. Even during your degree, they may have you to do some essays and stuff on topics that you find intriguing. In general, it's good to mention that you want to advance medicine in some way, even if you don't really, but it's good to mention it in some capacity during your interview. Moving on, it said that when I started my degree, I took the initiative to organize volunteering in A&E and shadowing with a professor in cardiothoracic medicine, which further solidified my desire to study medicine. So again, during my time on my degree, I did some shadowing with, I believe he was a cardiothoracic surgeon, but I think looking back, he was a cardiologist. But anyway, he was a consultant in some form of cardiology, and I really enjoyed doing some work experience with him. I got to see a few cases, and it really made my answers stand out when I was doing my interviews, because I realized that I had a lot to talk about. Having this real life work experience is something that is very essential when it comes to answering these questions. So first of all, how can we go about answering the question once we've given our brief monologue about why we want to study medicine? This is the core part of the question. This really gives you a chance for you to stand out from all of the other applicants. Of course, most people will have a very generic start to it. For me personally, I try to use basketball, but someone else could use football, or they could use tennis, or even just something completely different. But everyone will have their own reason for doing medicine that will more or less be similar. So these parts is where you can properly dissect it more. So first of all, you start off with a point. So what is the point that you're trying to get across in that sentence? During interviews, they're all very time pressured, so make sure that everything you're saying, you're not waffling, you're not saying stuff that isn't useful, because you are talking to a person at the end of the day, and if they get bored, they may stop listening. Of course, this is not intentional, but they may just get bored and stop hearing what you're saying and may mark you lower as a result of it, especially if you actually are waffling. So just try and stay on point, try and have a conclusion with whatever it is you're trying to say. Of course, you will be nervous maybe, but practice and stuff like that can help you get ready. So first of all, a point would be, for me, I want to work in an environment where there is a strong element of teamwork. So that's the point. The moving on for this, because teamwork is important as a doctor. And then the example I used was a shadowing example. So this example example, I'll just talk on it more, but it was when I was working in A&E, I got to see the multidisciplinary team. I got to see different doctors and nurses working together. I got to see the interactions of the team. I saw how they communicated. I saw how they all contributed to the care of the patients. So, that's the example I'm saying of the work experience that I'm using for this point, which is all about teamwork. And then E stands for explain. So explain this point. So for me, the main thing that I got from seeing this is I got to see teamwork in action. I got to see the working of the multidisciplinary team. I got to see communication. I saw how the doctors and nurses listened to all the patients, how they listened to each other, and they made sure to really digest what each person was saying in order to formulate an effective answer back. They weren't just rushing through questions when they were talking with patients. They were really trying to make the patients feel heard, and that's something that's very important when it comes to being a doctor. So those were 4 points that I've just mentioned now, and then after you've done this, then try and link it back to yourself. How have you tried to work on those during your own life? So for me, in terms of teamwork, I tried to be a part of the basketball team. I was a student ambassador. Being a part of the basketball team, I got to work as part of a team. I got to build friendships. I got to listen to different parts of my team. I got to listen to all of my team members and see different plays from their point of view. I got to listen to each member's opinion on how we should go about playing the game. I got to give my opinion, and then we all came to a conclusion. Being a student ambassador, I got to work with different members of my uni from different courses. I got to again listen to them. I got to communicate with them. I got to experience people from different cultures. And of course, linking this back to medicine, that's very effective, because in medicine, being any part of the healthcare team, you'll see patients from different walks of life. You'll see doctors, nurses, healthcare assistants from different walks of life. So it's good that you're able to know how to communicate with different people and how to listen to different people and work well as part of a team with different people. So again, we've broken down the points, which was teamwork. The example was me shadowing in A&E, and what I wanted to explain was how vital teamwork, working as part of a multidisciplinary team, listening, and communication. Those are the 4 things that I wanted to explain in this point. And then I talked about how I worked on those skills myself in basketball and being a student's ambassador. And then at the end of this, you can end it by saying something like, after you've done your points, example explained for 3 different skills, for example, you can end it by saying, overall, I feel very strongly that medicine offers everything that I'm looking for in a career: an intellectual challenge, an environment that heavily involves teamwork and communication, and lastly, a career that is constantly evolving and advancing. So, that's how I would end my answer after I've gone through 3 different examples, 3 different points, and I've explained all of them. I've given examples of all of them. That's how I would end my answer for why medicine. So again, I don't really want to go into the other 2 examples here because this video might be too long, but I'll just briefly explain them. So for 2, my example would be the cardiologist example, and that whole point would be I'm talking about how I saw communication. Number 3 would be about me wanting a career that is challenging and mentally stimulating, and the whole point of that example would be to describe how during my degree, during working as part of the basketball team, being an ambassador, volunteering, how I've able to work on my time management skills and how I plan to use those time management skills and organizational skills, hopefully be able to be a good medical student and consequently a good doctor. So again, maybe in a different video I might explain this, but having just gone through the first one, I feel like that's enough, and hopefully you guys can be able to use your own examples to work through your questions in this exact manner. Well, of course, for what most of you are here for, the Grey's Anatomy example, so let's get into it. Okay, so in this clip that we're going to watch, we are going to focus on 4 key skills. So we have teamwork, we have communication, we have making the patient feel comfortable, which falls into communication and listening skills. We also have something that could be improved. So hopefully you guys could comment down below once you've seen what could be improved. So let's get this video started.
This costume for days, and I have to go out of town today for work.
Last trip was Brazil. I got to go too.
I couldn't take her with me on this one, so we had Halloween early. We watched part of a scary movie and...
Poltergeist. It was awesome.
I paged Dr. Robbins.
Ah, you page, you got me. Taryn, I'm Dr. Karev. So, you have a stomach ache. You don't know any magic spells to fix it?
Well, we had some candy last night during the movie, and she got sick a few times.
So first of all, I want to pause this video just so hopefully this video won't get copyrighted. Hopefully you guys have spotted the mistake here between these doctors. Of course, it's more for comedic purposes, but we'll go through it at the end of this clip. But one of the first points we're seeing is he's making the patient feel comfortable. Like, he asked the question about how she's feeling sick in a very friendly manner, you know, so that's something that if you were actually there, if you actually see this during your work experience, you could pick up on that. He's not speaking to her as if she's an adult, he's speaking to her like a child, you know. Even though that may seem quite obvious or not important, it's good to realize that and to mention that for how you then use this to talk about how during your life you've maybe been tutoring, for example, and you figured out how to communicate between different people from different walks of life. Because being a doctor, you will have to be able to adapt your communication for your patients. Patients may not speak your language, some patients may not understand the medical jargon, so you'll have to explain their condition in a different way. Being able to adapt and to change and to work on how you talk to people is a very effective skill. And if you can use a real life example after this to talk about how you've worked on your communication skills, you know, then that can be a very good point to use during your interview.
Nice.
Ow.
She has some guarding and a fever, so it's probably not the candy. I'd like to do further testing. Draw labs.
I still get to trick or treat, right?
Are you kidding? The best trick-or-treating in Seattle is right here on the peds floor. You go around with these huge pillowcases. Everyone hands out as much candy as you can carry.
We see some more of the other doctor making the patient feel comfortable. We see some teamwork between them, and the mistake that I saw here between these doctors, of course, is for the show. There's some beef between these two characters, but of course, when the main doctor came in, he bumped into her, and you know, there wasn't effective teamwork or communication between those two doctors because she wasn't even aware that he was coming. So again, if you were in this scenario, how could you have improved this? Maybe the doctor could not have bumped into her. Maybe he could have told her before he was coming. Maybe between the two of them, they could have just appeared more friendly, more united to make the patient and her dad feel more comfortable. You know, these are just some things that we could improve and maybe possibly talk about. Maybe not in this question, but maybe in a question like, can you give an example of where you were in a difficult situation and then talk about how you worked that situation out? You know, this could be a good example to talk about. You know, maybe I would make sure to make my colleague feel comfortable. Even if we do have some disagreements between each other, we would not show that in front of the patients and ensure that the environment around the patient is, you know, safe, welcoming and comfortable. We're dealing with a child patient here. Often children, or even, you know, most adults, they don't want to be inside of the hospital. They already have some kind of fear. So it's very vital as a doctor to make them feel safe and to make them feel comfortable. In this case, the body language between these doctors showed that they were having some kind of disagreements, and of course this did not come across well. So, you know, that could be something that you could mention in a different question. So overall, from this clip, we've seen teamwork, communication, making the patient feel comfortable. How we could improve this is to just make sure that the doctors come in more united to make the patient feel even more comfortable and even more welcome. So again, from that clip that we've seen, the point of that clip be, you know, teamwork or communication, just whatever point you're trying to improve in that specific point for why medicine. You know, we've gone through it already, so this could just be. So again, the whole point of this video is just for you guys to open your eyes to real life experiences for when you guys go on work experience or volunteering, so you guys can pinpoint different things that you can mention when you go to your medical school interviews. Now again, please do not use this video or use Grey's Anatomy for why you want to study medicine. I just used it because, you know, it's easily accessible and it's an easy way to explain how you can go about deciphering in your interview questions. And again, I will try and maybe do some more questions in the future if you guys want me to. Please leave a like if you enjoyed this, please subscribe, and you know, and leave some suggestions down below of some stuff that you'd like to see me do in the future.